Welcome to the MedEvidence Radio Show, a monthly live broadcast with Dr. Michael Koren and Kevin Geddings of WSOS 103.9 FM and 1170 AM. MedEvidence. It's where we help you navigate the real truth behind medical research with both a clinical and research perspective.
Dr. Michael Koren is here with us. We appreciate him. He joins us once a month, and we talk about medical research and the truth behind all the data that's out there. We talk about studies here a lot on the radio, especially in the mornings. And to that end, Dr. Koren joins us on Monday mornings around 8:25, and we talk about a topic of the day, if you will, that usually relates to some form of, some health issue or medical research that's recently out there. This past Monday, Dr. Koren, we were talking about Damar Hamlin, of course, from the Buffalo Bills, and that amazing event that I think a lot of us will always remember on Monday Night Football, where he took a hit, got up, fell back down, and went into cardiac arrest.
Oh, it's really interesting, and I've debated with my colleagues and other people about actually what happened to him.
Right.
So we know he went into cardiac arrest. We know that he was a young, healthy, robust football player.
Right.
A nice story, sort of a low draft pick who has become part of the starting team and beloved by his fellow teammates.
Mm-hmm.
And on national TV, early parts of the game, he's part of the special teams unit that's defending against the kickoff. There's a runner from the other team, the Cincinnati Bengals, that runs aggressively out into the field of action. Damar Hamlin meets him around the 20-yard line, and they have a collision. Didn't look like the worst collision in the world, but they start to get up. Damar starts to get up. He gets up for a few seconds, then he collapses again. And he's in a situation where they're evaluating him. They probably first thought it was like a typical head injury or neck injury or something like that, which they're used to dealing with. But lo and behold, he goes into cardiac arrest. And then the team kind of figures that out pretty quickly, and we see firsthand the drama that unfolds as the teammates are saying, oh my God, this is something different than what we've seen. And sure enough, he's in cardiac arrest and has to be defibrillated.
Mm.
There's some debate about whether or not he was defibrillated once or twice, but he was down on the field for an extended period of time before eventually gets put into an ambulance and then brought to an acute hospital. And the good news, of course, is I think we all know by now that he survived,
mm-hmm.
even though they did not disclose that very quickly. That was the first question that I was asking when I was watching this live is, are they going to tell us if they restored his pulse or not, which they did. And ultimately, he got to a hospital and recovered neurologically, which you would expect if he was resuscitated within 10 minutes, which is what we've been told happened. And got transferred from a Cincinnati hospital to Buffalo Hospital. He didn't stay at the Buffalo Hospital very long and has been discharged to home as of today.
Wow. Yeah, that just happened within the last few hours. Moved from Cincinnati to Buffalo, and now Buffalo Hospital to home. So that's pretty good for Damar Hamlin, of course, the safety for the Buffalo Bills. So let's sort of dig a little bit deeper into that. So is it safe to say, by the way, we laymen would refer to it, that Damar had a heart condition?
Well, that's the question. So the thesis that was provided by most of the experts, including many of the medical experts, was what happened is a situation called Commotio cordis. Commotio cordis. So commotio is a Latin word that looks like commotion,
mm-hmm.
and cordis is a Latin word for the heart.
Yeah.
So basically what that means is there's heart chaos.
Right.
And what that usually describes is a situation which classically occurs when a projectile at a very fast speed hits the sternum. And it hits the sternum at a vulnerable period of time during the cardiac conduction cycle. So your heart, as you know, is a pump, and the pump requires an electrical system to tell it when to contract. And that electrical system has a vulnerable moment when the heart is relaxing and the electrical conduction is going back toward baseline. And that's the medical term for that is called repolarization. And there's a few milliseconds within repolarization where another shock, another electrical impulse can cause chaos. And so when you get hit in the chest by something at a high velocity, it creates blunt trauma that actually produces a very small electrical signal that can start this cycle where the heart goes into chaos. And that was the initial diagnosis and the first impression of people who are watching this. But it's not the only explanation. And there are a number of other things that could be actual reflections of some sort of intrinsic heart disease. Now, when you start talking about intrinsic heart disease in a professional athlete, especially in an NFL athlete, you get into a little bit of a controversial area because all these folks are screened for these things.
Right.
So nowadays, even in many states, including the state of Florida, if you want to play football on a high school level, you need to go through a basic screening. Mm-hmm. So a physician's going to listen to your heart. In many cases, there's an EKG done. And in some cases, there is an echocardiogram done, which actually takes an image of your heart before you're determined to be safe to play football. So if somehow somebody gets to the professional ranks and has a congenital condition that was missed, then that doesn't look good for all the people who are supposed to be doing the screening.
Interesting. Do we know of times, I could imagine in professional boxing, someone would get a punch to the chest, right?
Yeah, and it doesn't occur there because, again, the velocity of a punch is not typically fast enough to cause this. And that's actually bringing up one of the reasons I'm skeptical about the diagnosis of Commotio cordis. So the classic example is you have a young man, a high school athlete who's a pitcher, who gets hit in the chest with a line drive.
Okay.
So you have a baseball, a hard object that's hit into your chest at 100 miles an hour. And that is the classical way that you have this condition. Mm-hmm. And of course, in many cases, it can be lethal because there's not a resuscitation team available for a high school athlete. But interestingly, you see that way less in the major leagues for a number of reasons. Probably the most important reason is that the chest wall of a 25 to 35-year-old man is much thicker than the chest wall of a 15 to 18-year-old person. So the impact and the electrical signal that's caused by the impact is actually going to be more profound in a younger athlete than somebody who's older. Because you probably can't think of an example in a professional pitcher. Plus, they're also probably the best athletes. They have the fastest reflexes. They're less likely to get hit in the chest like that by even 100-mile-an-hour line drive that's hit right at them.
So if it had been possible to basically check his pulse and check his blood pressure 5 seconds before he had cardiac arrest on the field, it stands to reason that would have been normal, right? There wouldn't have been any indication that he was getting.
Yeah, exactly. You're right. Exactly right. There's nothing during the game where you would be able to look at. As far as I know, they're not doing EKGs before games, or they're not even checking pulses and things during the games unless somebody complains about something.
So is it just possible that sometimes you have a heart attack and it's a random event?
Yeah, well, I don't think it's that so much. I think there's probably something related to the incident, but it may be different than Commotio cordis. So let me give you examples. So we know that when you're in a situation like that, there's a huge adrenaline rush. Mm-hmm. And what can an adrenaline rush do? It can cause other arrhythmias.
Right.
So a common arrhythmia that it can cause is atrial fibrillation. Mm-hmm. And he could have been prone to atrial fibrillation or atrial flutter or what's called a supraventricular tachycardia. These are all things that can be triggered by adrenaline. And certainly I would have my adrenaline running if I was rushing, if I was in that situation.
Right.
So I'm sure even professional athletes experience the same thing. In fact, they need it to perform at their highest levels. Mm-hmm. So it is possible that adrenaline rush uncovered something that was there that he was prone to originally.
Hey, if you're just hopping in the vehicle, we're taking a little break from the music here because Dr. Michael Koren is with us live during this lunchtime on this beautiful Wednesday. And he, of course, with ENCORE Docs, and they do clinical trials. They give you an opportunity to participate in medical research and get some of the best health care you'll ever receive. Go to EncoreDocs.com. That's ENCORE Docs, EncoreDocs.com. Dr. Michael Koren, of course, is a medical doctor, a cardiologist, and a research scientist as well. We're talking about the Damar Hamlin situation, but also lessons learned in that and some things that relate to heart health that flow from it. I guess unless this happens again on a football field in the next year, we'll just chalk it up to a random experience, right?
Well, I'm sure there's going to be some digging behind the scenes, and I'm also sure that the NFL wants to keep that quiet while they kind of figure things out. So getting more into what could have happened, there's a congenital condition called hypertrophic cardiomyopathy. And it's a condition that we have studied and are studying as we speak in our research facilities. And that's a congenital condition where there's some thickening of the heart. And because of the thickening of the heart and the fact that the tissues grow in a way that isn't as structured as it should be, there can be a randomness to the rhythm. And that randomness of the rhythm can cause sudden cardiac death. So now an echocardiogram, which is part of the screening for NFL athletes, can distinguish the worst cases of that, but in some cases it can be difficult because anybody that does a lot of weight training or somebody that has high blood pressure outside of the athletic realm can have some thickening of the heart. And it's sometimes very, very difficult to discern thickening that's congenital from thickening that's due to working out like a madman. And so that is sometimes a challenge for even the best cardiologists to figure out. And of course, there's going to be pressure on the doctor who's involved to pass the people. There's a huge amount of money that rides in this. People's careers and reputations and their ability to participate at the highest levels depends on the doctor's reports. So of course, they're going to be very careful about excluding a borderline person from athletic participation under certain circumstances.
Right.
And so that's one of the considerations. And then the other thing that's often very, very difficult to diagnose is something when you have a concealed electrical pathway. And what that means is, as I mentioned, there's an electrical system in the heart, and the electrical system has a standard way of running. It usually starts from the top right, it works its way down towards the middle of the heart, and then spreads out from there. But sometimes people have an extra wire in their heart, which can conduct the bottom of the heart through a non-standard pathway. Now, that often will show up on an EKG, and people may have heard this term Wolff-Parkinson-White syndrome, which is something that we can pick up on an EKG. But sometimes the nature of that pathway is such that it doesn't show up on an EKG. And in that case, somebody is at risk, and you may not even know it, even though they've had the standard screening.
Okay. That's the voice of Dr. Michael Koren once again with ENCORE Docs. So you're obviously a medical doctor, cardiologist. What's the prognosis? So Hamlin is home today. That's exciting news, right? What will his life be like 30 days from now?
It should be great.
Okay.
His prognosis is really good. Again, we don't have all the details, and some details are very, very important. But let's assume that he was resuscitated within 10 minutes. And we know that he was talking and he was asking questions and he was kind of responding normally from a mental status standpoint. So I would think that most of his neurological functions are intact. And that's what you're always worried about. When somebody's down for a long period of time, you can have brain damage. We call it a hypoxic encephalopathy is the medical word for it. But basically it's parts of your brain stop functioning because they were deprived of oxygen for an extended period of time. But that does not appear to be the case in a major way. Now, maybe in a minor way, he may lose some memories. There may be some cognitive features of his life that are impaired because of this episode. But the fact that he's walking and talking and doing a bunch of things means that his prognosis is actually excellent from a neurological standpoint. Now, his football prognosis is he's done with football.
Wow.
There is no competent physician that would ever clear him. And so if there's any discussion about that, the answer to that is absolutely not. But, he's famous now. So his prognosis professionally might be actually quite good if he has some basic skills.
Yeah. Go be a spokesman for the American Heart Association.
Absolutely.
Yeah. So can he assume that unless he gets hit hard in the chest again, he's going to be okay? Or is he somebody that's going to be like worried about, am I going to have a heart attack at 35?
Well, that's where these other diagnoses that I mentioned come into play. So I imagine he's already had some pretty extensive testing about his underlying condition. And if he's not, he will have a lot more.
Right.
And so he'll be tested extensively for hypertrophic cardiomyopathy, including some of the newer genetic tests and MRIs and things that are not necessarily part of the first line of screening of professional athletes. He'll also be looked at from what's called an electrophysiological standpoint, where they'll do testing to see if his electrical conduction system in the heart is normal or if there is an abnormal pathway. Now, those things can be treated. So, for example, if they find that he has an abnormal electrical pathway, they'll ablate that. They'll take a catheter, and we do that work here in St. Augustine, and we have some great doctors in my practice that do that work, and they'll identify that electrically active area and use some sort of modality to destroy that little bit of tissue so that that active pathway is no longer active.
That's Dr. Michael Koren. Going back to the actual event that we all saw on national television where Hamlin was on the ground, if you will, would he have survived if they'd only been able to give him CPR?
Not for a very long time. So yeah, it's funny. We had mentioned this right before we got on the air. But imagine if the football interaction actually saved his life.
Right.
So let's say that he has this concealed conduction, and he went into atrial fibrillation at the football game, and it was related to the contact. Well, the fact that it happened during a primetime nationally televised event where they had a fully staffed medical team ready to pounce on him may have actually saved his life.
Wow.
So think of that as a crazy idea that the hit actually saved his life.
Yeah. Yeah. It seems reasonable to assume had he been just at home watching television by himself in his apartment, he may not be with us today.
Yeah. He might have been watching another game and excited about the fact that that the Bills got the first round bye.
Right.
He goes into atrial fibrillation. That leads to ventricular fibrillation, and he dies, and there's no one there to resuscitate him.
Wow. Does that argue for having more of these, the paddles, if you will, the electronic machine that restores heartbeat at more locations?
Yeah, defibrillator access is important. We know it's in all airports now. They're pretty simple to use now, but still people sometimes don't know how to use it, and we never get to practice on how to use it.
Right.
And we often don't know where they are, but they're on all airplanes now. They're in all airports. They should be in virtually all schools at this point. Certainly, of course, in medical clinics and in hospitals, et cetera, et cetera. So they're widespread, of course, but there are other places. Are they in grocery stores? Well, probably not. Should they be? Probably yes.
Right, yeah. That's Dr. Michael Koren, once again, medical doctor, cardiologist, and also, of course, with ENCORE Docs, and they are right now conducting clinical trials that deal with some cardiac health issues, right? You have some studies ongoing.
Yeah, very, very relevant studies to this problem. So cardiac death due to arrhythmia is really the number one source of death, and sudden cardiac death is still a huge problem in the U.S. despite many, many advances in cardiovascular care. And so we're doing a lot of work to try to identify people who are prone to this problem, who are most at risk. So here in St. Augustine, we're doing a study as we speak, looking at an app that you can speak to that detects changes in your voice pattern and determining whether or not those changes are associated with higher risk of having complications of congestive heart failure. So if you've been diagnosed with congestive heart failure, give us a call, and we can get you involved in this program that's really, really simple. Literally, on your phone, you can talk to it, and the phone will help determine your risk. And you get paid for volunteering in something like this, which is kind of neat. Mm-hmm. And it's also advancing science and can be part of the legacy of coming up with better technologies for identifying people at highest risk.
And during that whole process, you're getting some of the best healthcare you'll ever get.
Absolutely. We have a team of really the best and the brightest that are going to be looking out for you.
Yeah.
And, as we all know, in the current medical environment, physicians and other healthcare providers are so pressed for time. And there's such pressure on high volumes because of the huge demand for our services that we can't always spend a whole lot of time. But in the research realm, because our responsibility is to get every single detail to the Food and Drug Administration, it's a very, very nurturing process where the team spends a lot of time with you.
Yeah. That's Dr. Michael Koren. Once again, you can learn more about what he's talking about, the studies that are going on right here in St. Johns County and St. Augustine. Their office is in the Whetstone building next to Flagler Hospital. Go check out the website, ENCOREDocs.com, or call this number. Like Dr. Koren had mentioned, the phone number is 904-730-0166. We're spending time once again with Dr. Michael Koren. He is a medical doctor, of course, cardiologist, and also a research scientist, and he is involved in many, many clinical trials. The opportunity for you to engage in some really leading-edge medicine, and you get to do it. It won't cost you anything. You'll probably make a little bit of money in the process, but you're also going to be a part of advancing our society when it comes to our health, right?
It's neat, yeah. And people have different motivations, as you point out, for being involved in clinical research. The statistic I like to always mention is that there's always a little bit of maybe slight skepticism about being part of a clinical research project for people that have never been exposed to it. But once you're exposed to it, 99% of people who have been in one trial will do a second.
Yeah.
So there's very, very few things in life where 99% of people who use a product will say they'll use it again.
Yeah. Well, certainly here at the radio station myself, I've been involved in these trials with Dr. Koren and his team. So is Karen. My wife, Christy, has as well. We know a lot of, we actually have other clients here at the radio station who have been a part of those same trials at ENCORE Docs. So we encourage you to learn more. It's a great experience, and you're going to get healthcare like you've never experienced it before. It's not going to be rushed. People smile. They are very kind.
Yeah, it's a neat process.
Yeah.
It's a really neat process.
And also, a lot of times we complain as consumers that, the doctor's not really listening to me, the nurse really isn't, or they're so busy and overwhelmed, we don't feel like they're really absorbing what we say. Mm-hmm. It's just the opposite when they work with, we work with you, because you guys are actually trying to get our feedback.
Right. Yeah, we're
part of the job.
We're trying to extract every detail out of you.
Yeah. Well, it makes you feel like, it gives you some sense of value. So we encourage you to learn more about how you can participate in these trials by going to EncoreDocs.com. That's EncoreDocs.com, spelled E-N. That's EncoreDocs.com. The telephone number locally here in Northeast Florida, 904-730-0166. Speaking of studies, I saw one over the last couple of days about the increased level of liver disease among young adults under the age of 35. And a lot of people that are commenting on this particular study felt that it had a lot to do with alcohol consumption by the younger generation. So
interesting.
Sometimes we think of baby boomers, or as you and I are both baby boomers, when we think back to our parents and our grandparents, we think, wow, those guys were drinkers, but apparently they were amateurs compared to the 28-year-old male today that regularly will consume a couple of bourbons every night. So, but it's leading to liver disease. And I know you're doing some research right now on some of the issues relating to liver.
Well, fatty liver disease is another pandemic. And we've had this discussion, but just remind everybody, fatty liver disease is the number one reason for hepatic cirrhosis of the liver, and liver transplants. So it used to be hepatitis, but we have great drugs because of clinical research, and hepatitis is no longer the scourge it once was. We can actually cure the vast majority of people with hepatitis these days, but fatty liver is something that we really haven't had any good treatments for. And with the population getting more and more obese and certain members of the population drinking more alcohol, they are more prone to this really horrible thing that can lead to scarring the liver, all kinds of complications, and in some cases, the need for a liver transplant.
Yeah. This particular study was talking about one of the largest increases in history, I guess, since I've been tracking this, of young adults needing liver transplants because of alcohol consumption. Right?
Yeah. Well, I'm going to guess, I have to read the study, but I'm going to guess it's alcohol with something else. But there's been some debates that when the drinking age was changed to 21, it encouraged binge drinking in colleges. So, when I actually turned 18 right when they were starting to change the rules.
Right.
So when I was in high school, there was no drinking age. We used to, if we had a party in high school, we'd call the liquor store and ask them to deliver liquor, and my 10-year-old brother would pay for it.
That's right, with a cigarette in his mouth. No, I'm just kidding.
Yeah, but that was kind of the standard when I grew up in New York.
Or have a keg delivered.
Yeah, so then obviously things got a little bit tighter in the 80s, and they changed the drinking age to 21. And it's funny, I went to college in Massachusetts, so I was always like a week younger than I needed to be legal all the time.
Right.
So for 3 years, what happened is that I was legal, then became illegal for a week, and then became legal and illegal for a week. And it's one of these anecdotes about how government rules can sometimes be silly. But anyhow, bottom line is now 21-year-old drinking age is pretty standard. And what has that done? Well, of course, college kids drink, and they just can't drink publicly anymore.
Right.
So they drink in their dorm rooms or in their friends' places, and they tend to binge drink. And that may be part of this issue, is that it's starting a type of behavior that will have implications even once they become of legal drinking age.
Yeah. It'd be an interesting study, right, to take a look at the levels of binge drinking or alcohol consumption among young people in Europe, where the rules are a lot looser, right, as opposed to here. I mean, there doesn't seem to be a whole lot of mystery around drinking wine in France when 15-year-olds are having it with supper.
No,
right?
exactly. That's right.
Yeah. That's Dr. Michael Koren. He's here with us. An important note, too, going back just a little bit to the heart study that you talked about, sometimes when we mention these clinical trials, people just assume it's automatically taking a pill or taking some sort of injection, but sometimes it's having a wearable device.
Yeah. So getting back to the heart monitoring, the technology for monitoring things at home is getting better and better. People have Apple Watches now, and other, not just the Apple brand, but other watches that look at your heart rate, monitor your sleep, and do all these things. And on a consumer level, they're getting better and better, but it's not as precise as you need to be for medical diagnoses. So we are now developing these really, really high-tech monitoring systems that can tell us little details about how your heart rate fluctuates over the course of a minute and whether or not that variability has some importance. We have devices that can look at your breathing patterns over the course of the day and whether or not that really matters. We have devices that look at sleep in ways that just standard devices can't look at. And with all these monitoring systems, when you subject them to certain software manipulations, particularly artificial intelligence, we can come up with insights about individual patients. So as we speak, we're working with a company that has a very portable device that people can wear for 2, 3, 4 weeks in a row that gives us incredible detail about their EKGs. We get medical quality EKGs from home 24/7. And so we can come up with incredible insights about the little electrical conduction system of the heart.
Right.
So we're looking at actually pretty much all comers, people who are healthy, people who have high blood pressure, people who have been told that they have enlargement of the heart. That's a very important population. We know that if you've been told that you have an enlarged heart, whether or not it's by EKG or chest x-ray or by echo or by a physician examination, you are much, much more prone to complications. But within that group of people, we want to identify the subset that's truly at risk. And these monitoring devices can help us do that. I mentioned hypertrophic cardiomyopathy, which is another form of heart enlargement. Those people are at extremely high risk for sudden cardiac death. And these devices that we have can identify if you are one of those people that can anticipate having a major complication.
Yeah, it's interesting because I know sometimes we hear these stories, at least as a layman, of people that have gone in, they've had some chest pain issues or whatever over a period of time. They go in and have an EKG and everything's fine. And then 3 weeks later, they have a heart event. So you got a much better chance of catching what the issue would be if somebody is being monitored for 3 consecutive weeks. Right?
An EKG gives us valuable information, an office EKG, but it's a 12-second snapshot.
Right.
And the algorithms are getting smarter and smarter. And we now know that looking at the way information changes over time is as powerful or more powerful than just a single snapshot.
Yeah.
So one of the ways the lay people can look at it is the difference between a medical interaction that's a photograph and a medical interaction that's a video.
Wow, interesting. So you think we'll be around, Doctor, when will we ever get to the point where, remember Dr. McCoy on Star Trek, he had that device in his hand. And
the tricorder,
Well, he could wave it over your body.
Right.
He could say where the tumors were, and he could tell you whether you had any kind of a lung issue.
That day will come, I'm sure.
All right. We'll be in the assisted living center reading about it. Dr. Michael Koren is here with us. Of course, you can connect and learn more about all the different studies they're doing and how you can participate very easily by going to ENCOREDocs.com. That's ENCOREDocs.com. They're locally based, so you can call them here locally in St. Augustine and St. Johns County at 904-730-0166. Dr. Michael Koren is here with us, and he is a research scientist and a medical doctor and cardiologist, of course, with ENCORE Docs. And he heads up a variety of clinical trials, medical research that's going on all over Northeast Florida, but a lot of these trials go on right here in Greater St. Augustine at their offices near Flagler Hospital. One of the things that you guys are looking at is the whole issue of dementia and I guess Alzheimer's as well, memory loss.
Yeah. We were just talking during the break that Damar Hamlin may be at risk for having some memory issues, either acutely or in the long term. And we're learning more and more about what factors are important. So one of the areas of research now is this concept of the tau protein and how the tau protein is an influencing factor to Alzheimer's dementia. And we're doing studies where people have their tau protein levels assessed. And if they have high levels of tau protein, we actually screen them for changes in their brain. And they get all these very, very expensive tests free of charge for people who may be at high risk. We're actually looking at studies now for people that have no symptoms at all. So they may be the sharpest people in the world, but they have high levels of tau protein, which could predict for future development of dementia. So we're doing a lot of neat stuff. And what I would say to people who are listening is that if you're concerned about it, give us a call. We can do a memory screen to see if you have any actual symptoms of memory loss. And we can possibly do your tau protein level to see if you're at risk for future problems.
Okay. That's Dr. Michael Koren. And once again, you can learn more by calling this number, 904-730-0166. That's 730-0166 for ENCORE Docs. A lot of folks out there, Dr. Koren, dealing with cholesterol issues and lipid challenges, those sorts of things. You guys are doing a lot of research in that area.
Yeah, and a lot of these things are connected. So you mentioned cholesterol. And there's been a lot of discussion about cholesterol and brain health. So the brain has a lot of cholesterol in it, but brain cells actually make cholesterol. And so the brain cells can make plenty of cholesterol, and the stuff that is in your circulation tends to be the stuff that your body's trying to get rid of, not what your body needs. And so studies have been done to show that getting cholesterol levels to super, super, super low levels, like LDLs of less than 25, have no impact at all on brain health. And in fact, they probably have a slight benefit on brain health because most people that develop dementia don't have Alzheimer's dementia, but actually have vascular dementia from little strokes.
Okay.
So lowering cholesterol prevents strokes. Fewer strokes, less likely to develop vascular dementia, which is the most common cause of dementia in the Western world.
Wow.
So there's all these very, very interesting connections, and we'll do cholesterol screening for you if you're concerned about that. If you've had a stroke, let us know. We can get you involved in a program that will reduce the likelihood of another stroke. And in fact, get you into a situation where you're probably going to have better long-term health consequences because one, you're in a clinical trial, two, we're monitoring not only standard lipid parameters, but also the lipid parameters that are not as well known by the physician community and not always tested, like lipoprotein little a,
right,
which is something that is a problem for about 15% of all people, and which most doctors don't test for because they haven't been trained on it, and we haven't had a medicine that's particularly good at lowering it. But that's changed.
Okay.
And we have drugs now that are amazing at lowering it, and they're not on the market yet, but we're working with them in clinical trials.
Yeah. I've learned from you over the years, of course, that statins one of the greatest inventions of mankind, right?
Absolutely.
And yet, and even in that field where we're trying to lower cholesterol and obviously did it fairly successfully for most people with statins, there's still room for advancement there.
Absolutely. So statins are certainly, arguably, the most impactful class of drugs ever developed in terms of reducing heart attacks and strokes. But some people can't tolerate them. About 15 to 20% of people just cannot tolerate statins. And statins don't get people low enough in certain circumstances. So if you have a very, very strong family history of heart disease, or you're taking a statin and your LDL cholesterol is still above 50, you may need something more.
Well, if you have any of those issues, or you know someone who does, there's maybe a family member, a friend, or a neighbor, you should get them in touch with ENCORE Docs, with offices right here in St. Augustine and St. Johns County. EncoreDocs.com. Call this number 904-730-0166. That's 904-730-0166. And Dr. Koren, when they go on the website and they see these trials, they should probably go ahead and make that phone call to ask some basic questions, right, and figure things out.
Yeah,
start
absolutely.
the process.
Yeah, so we have a policy that if you become part of our research community, which basically is agree to get emails and be part of the discussion that goes on, you'll be eligible for a lot of free screenings. So you can get your cholesterol screen for free. You can get a fiber scan of your liver for free. You can get EKG for free, et cetera, et cetera. So again, this is for our community of people who are willing to share the information with one another.
Yeah.
So it's a neat little benefit. And there's a lot of little tidbits that people learn that are not even that well known in the medical community. I'll give you an example of that in this realm that we're just talking about. So lipoprotein little a is, again, this what we call the really, 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 really bad cholesterol. And people that have that typically have a family history of heart disease or stroke, and typically will have complications of atherosclerosis at an earlier age than usual. But not everybody knows about it, mostly because we don't test for it routinely in the medical community because we don't have anything that treats it specifically. But what most people don't know is that LPA can actually show up as LDL in a standard test. And you wouldn't even know that you have high LPA, but you might have an LDL level that doesn't go down as readily as you expect with statin drugs. So a typical example is somebody takes a statin. The statin, let's pick atorvastatin, the most common statin, which is known as Lipitor. You take 80 milligrams, the highest dose, and you would typically expect about a 50% reduction in your LDL. But I've had patients that say, Doc, this Lipitor that you helped develop is not so good. I only got a 20% drop in my LDL. What's going on? Well, the answer to that may be that your LDL measurement is actually reflecting lipoprotein little a, and statins don't work for lipoprotein little a. So the way we do the assays for LDL cholesterol is such that the LPA is also included in the LDL measurement.
Okay.
So that's a tidbit that probably maybe 10% of physicians know, and that we deal with these kind of bits and pieces of knowledge in the research realm. And these are bits and pieces of knowledge you'll get as part of our community.
Yeah. It's all about good information, right?
Absolutely.
The ability to participate in a very transparent environment, lots of information that you'll get. You'll enjoy this process if you choose to become a participant in a clinical trial. I have done it. I highly recommend it. I've done it with ENCORE Docs. I encourage you to learn more by going to EncoreDocs.com. It's convenient right here in St. Augustine. EncoreDocs.com in the Whetstone Building near Flagler Hospital. 904-730-0166 is the telephone number where you can get the process started. Ask some questions. If you have any questions after you look at the website, that's the number you need to call, 904-730-0166. As we wrap it up, Dr. Koren, any closing thoughts for our listeners?
Well, again, we started with Damar Hamlin, and let's just end it on an optimistic note that modern medicine was able to identify the problem, resuscitate him. Our producer just mentioned the fact that when Damar Hamlin left the hospital, he announced the fact that he had T-shirts made, and there were 2 points that he wanted to make on these T-shirts. Number one, his first question when he regained consciousness was, "Did we win?"
Right.
And so it just shows you his dedication to his team, but also from a medical standpoint that the brain was still functioning, that his priorities in life were, in fact, still his priorities in life.
Yeah.
And then the other thing that was kind of neat is that he wanted to donate money to first responders.
Yeah.
So as you know, there was a huge outpouring of support from lots of people, including very high-profile professional athletes, to fund his foundation, which was getting gifts for kids. Mm-hmm. And it sounds like it's going to expand now to supporting first responders. Yeah. So that's a really, really neat concept. And also a point that we're getting better and better technology, and the technology that the first responders are using are based on clinical trials. Yeah. So the fact that they don't know what to do under these circumstances is because we've done studies that show them what to do.
Yeah. It all starts with research, and research that all of our listeners could potentially participate in.
Absolutely.
Yeah. You can do that by going to EncoreDocs.com. That's EncoreDocs.com. Dr. Michael Koren, thank you for joining us, and we'll talk with you again on Monday morning.
Look forward.
Thanks for watching the MedEvidence podcast. To watch the rest of this series, head over to medevidence.info or subscribe to our podcast on your favorite podcast platform.